What an amazing discussion so far this morning, the great thought leadership that has been here on stage. And now we have the privilege really to put a face on this and to talk about the human impact of gun violence. And I know that, at least for me, when I see the images of the mass shootings on TV, and I see the faces of the victims, and I see the grief and the suffering that goes on in those places. I can't even imagine what that must feel like to be directly affected by that. And many of us have never had the opportunity to speak to somebody about that. And today we have this opportunity here with Sandy and Lonnie Phillips, who have been in that situation, are still living that life because they lost their daughter in the horrific events of the Aurora theater shooting. And we are very grateful for you to be here and to share your story with us. So please tell us what brought you here today and what you're doing today.
We're honored to be here today, and thank you, Michael Dowling, for inviting us. Jesse was killed in the Aurora theater shooting. That happened 5 months before Sandy Hook, and we were kind of forgotten. And during that time, trying to make sense of our lives again was extremely difficult, and we didn't have any hand to hold. So when Sandy Hook happened, we deployed to Sandy Hook and held their hands. And those people became our friends, and we were able to tell them what the first year is truly like, not just from the grief, but from the other things that assault you. People raise money for you that they never intend to make sure you get. People call you hoaxers, that you're actors, and that this never happened to you, and that your child never existed. You deal with a trial in our case. So all those things that come at you at such a quick pace and overwhelm you, we had no one to do that for us. And so we decided after Sandy Hook that that's really what we wanted to do. We wanted to respond to these mass shootings and help all survivors of mass shootings and gun violence, whether it's a mass shooting or not, to have the support, the peer-to-peer support from survivors, and the trauma support, the trauma therapy support, which is often left out as recently as Parkland. So they got counseling, but they didn't have trauma-informed counseling. So that's what we do now, and we've done it 15 times since our own shooting in 2012.
Can you share a little bit more about the mission, Lonnie? Maybe if you want to, whatever you want to add to that, about your organization.
About our organization, Survivors Empowered. We've only started that in 2017, so we were into that before. We were working for other organizations. The first organization we went to work for was Brady. We worked with them for almost 2 years. We didn't seem to be getting along as quickly as we were with Brady. They were focused on programs like Bad Apple Gun Dealers, and they would hold a rally, and they would pinpoint the gun dealers that were selling the most guns and more guns than they should to a certain area. And we just decided that we needed to get more in touch with the survivors. They weren't dealing with survivors the way we thought they felt. So that's why we formed Survivors Empowered.
Well, and I also think that we saw the opportunity to advocate and activate survivors. Many of them choose not to become politically active. Many of them do. So be able to say your voice matters, and your authentic voice matters. And don't let some of these bigger gun violence prevention groups tell you what and how to say your story, to tell your story. And we kept hearing that over and over and over again. And we saw survivors being used, and abused by the very organizations that should be protecting them. So we have kind of stepped in and said, tell your story, tell it the way that is effective and empowering, and tell it at your level, tell it in your neighborhood. Start in your neighborhood, and then go to your city, and then go to your state, then go to your region, and then go national. But your voice matters, and many of them have been told that their story doesn't matter, especially those of suicide. And they're the #1 cause of gun violence in our country. So it made no sense to us. So we started empowering people and started to make them feel comfortable telling their stories.
And the fact that's already been mentioned here, that for every one killed by a gun and gun violence, it leaves 3 that are wounded, and those wounded are being neglected and not taken care of and abused also. And that's one of our main goals, is to bring that to light.
One of the things that hasn't been mentioned today is that it costs this country $229 billion every year to take care of those who have been affected by gun violence. That number is so astronomical that people have trouble wrapping their brains around it. And we feel like it's our job to bring the attention to that, because we know these people. We see their pain. We see their daily struggles just to get out of bed and put clothing on. I was telling Sven earlier that a young man in our shooting, 4 years later, had to have his leg amputated. 4 years of pain and suffering from a gun that was used in our theater shooting, a weapon of war. Another young lady in the theater completed suicide. She had only lost 3 fingers, but it was a constant reminder to her of what she had gone through, and she ended up taking her own life. In Sandy Hook, we have a father who took his own life. We had 2 Parkland students this last summer take their own life. So it's the ongoing struggle of survivorship that most people don't really have a clue of what it's like.
Something else that I heard from you earlier as we were talking during the break is, and that actually is mind-blowing to me, is that Jesse was actually a few weeks before the shooting in the theater was involved in another shooting in Canada, correct?
Yes, we have a whole subclass now of people who have been in mass shootings more than once. Our daughter was in a mass shooting in Toronto, Canada, 7 weeks before she was killed. She wrote about it in her blog. She was a writer. She wrote about it in her blog, and she said, every second of every day is a gift. She realized how fragile life was, but 7 weeks later she was taken. A young man in Las Vegas, in the Las Vegas shooting, was a hero that night, and he was killed in the Borderline shooting. We are hearing more and more, the more we travel, of people who have been in one shooting and now have been affected by another. We know mothers who have lost all 4 of their children to gun violence at different times because they live in neighborhoods they can't afford to move from. This is the real down and dirty of gun violence that most of us never see. Those of you in the room know what a 223 will do to the body. Imagine 7 to 9 bullets hitting a 7-year-old child and what that does to the body. Our daughter was hit 6 times, and we know what it did to her body. The kill shot for her was a 5-inch hole in the side of her face that blew her brain out onto the people that she was with. So these are the things that we live with on a daily basis, that we see on a daily basis, that we hear from others on a daily basis. And just to be confronted with that day after day after day without the support of our elected officials, without having them move the needle, choosing not to move the needle, is deplorable. I'll use that word. It's deplorable. And these people need our help. They need trauma therapy. They need the police to back them up. They need the doctors in this room to organize and move the agenda forward politically. So we're very, very glad of what's taken place here. We have been very, very big on coalition building through these last 7 years. And to know that that's happening in this community and that we might be lucky enough to be a part of it is truly humbling.
It's really it's really remarkable how you find the strength to do that, and that you go to these forums now. And today you have a forum here of healthcare professionals. And what specifically would your message be and your ask of this healthcare community? What support can the clinicians and the caregivers provide that will help the survivors in their healing process?
I think to organize and tell your stories. When Dr. Saccharin started talking about he had also been a survivor, does everybody in the room know who Dr. Saccharin is? I would assume that you do. I just want to be sure because I could be wrong. When he started telling his story as both a survivor and a doctor, that was so powerful to our community of survivors to hear that story and to begin to see you take those political steps. The other doctor that was here earlier, I don't know if he's still or not, but his story of fighting this since 1983. And now we're just now getting to this point, you know, and that was 1983. So this gives me, it gives us, and I'm not just talking about my husband and myself, I'm talking about the entire survivor community. This gives us hope. And if you do nothing else, you have given us hope. So don't stop here.
What words of advice would you share with others that confront tragedy, that are in those situations? And Lonnie?
Well, there's a lady here that lost her son. I talked to her earlier today. She's here today. And she has been following us, and she's come to me and asked me, you know, will I ever get over this? And she was so grateful for what we're doing, and she wanted to know how she could help. And I said, you're helping me right now by telling me that we're helping you. And that, to us, is what keeps us going. And that, I mean, we've heard it all. A quick story right after it happened to our daughter, 2 days after, we had a whole lot of people in our house, and I went down to the 7-Eleven to get some ice, and I saw a policeman there with a gun. He was a detective. His gun was hidden in his badge, and I just couldn't resist. I don't usually talk to people, you know, in line in a grocery store, but I just asked him, I said, what do you think about in this country we allow people to have access to an automatic weapon? And he looked at me and he said, guns don't kill people, people kill people. And I was shocked. And I didn't know what to say, and I just looked at him and I said, well, if guns are not the problem, people are the problem, why do we give the problem to the people?
To guns.
Yeah.
Why do we give guns to the people?
Why do we give guns, why do we give the problem guns? I mean, if that's really that simple line, and that's the mantra of the NRA, the simple answer is, why do we let the problem have guns?
Also, you were co-writing a book recently
Yes.
that just was published. You might give a
Yes.
quick commercial for that?
I'm happy to.
Well, we've heard the word culture a lot here.
Yes, and our book includes that title.
The name of the book is Tragedy in Aurora, The Culture of Mass Shootings in America, and it covers everything that was said today and more. It was not written by us. It was written by an author that's already written 4 books about the gun industry, Tom Diaz. Look it up. He's very, very well versed, and he brings up questions that hadn't been brought up here today, and he has some solutions. It's not an easy read because it's very detailed, and it's got like 20 pages of notes and 25 pages of bibliography, so it's well documented. I think it would help everybody in this room, as a matter of fact.
So recently you were on, I think it was the weekend of the El Paso shooting, on Anderson Cooper on 60 Minutes, and
Yes.
Anderson talked to you about you go to these dark places, and you said you don't see it as such. You are bringing light to those places. And
Exactly.
on behalf of everyone here today, I want to thank you for bringing light to this place and for the work that you're doing. So keep up the amazing work. Thank you.
Very nice. Thank you. Thank you.